Hi, this is Dr. Mark Skeen. I'm an associate professor of neurology at Duke University Medical Center, and this is another in a series of videos talking about multiple sclerosis. Last time we had an overview. What I'd like to do now is talk a little bit more about the diagnosis. Like most of medicine and all of neurology, the diagnosis of multiple sclerosis is not made on the basis of a single test, but on the result of a number of indicators and putting all the pieces together and trying to decide, is multiple sclerosis the condition. There are particular symptoms that are common in MS, but none of those are specific for MS. In other words, all of the symptoms of MS can be produced by other conditions as well. So when we have some concern that this represents multiple sclerosis, we take a history about how the symptoms people have had, how they might have come and gone, what parts of the nervous system may have been involved. We also do a neurologic examination to see which portions of the nervous system, central nervous system, are working well and which are not. And we do MRI scans to see if we can see evidence of scars or inflammation in the brain and spinal cord that look like MS. We may also look at the spinal fluid because there can be hints there. We can do some other tests called evoked potentials. But in many people, the examination, the history, and the MRI are the most diagnostic aspect. We talk about the diagnosis of multiple sclerosis in terms of it being generally a relapsing and remitting disease. And so we want to see that people have recurring episodes of neurologic trouble over time, and that those recurrences involve different areas of the brain and spinal cord. So usually recurring troubles are not the same symptom. Usually they're different symptoms because different parts of the central nervous system are involved. The MRIs often show little white spots. It depends on what software we're looking at, but most of the T2 or FLAIR images that we use in the diagnosis of multiple sclerosis reveal abnormalities that are bright or white. Then there are many things that cause white spots in the brain and spinal cord, but some of the findings that we see are so characteristic of MS that it's difficult to believe that it would be anything else. And other ones are not so specific. They could relate to old strokes or to migraine or to previous concussive injuries or any number of things sometimes that we cannot identify. And so it's often the overall pattern of abnormalities on the MRI of the brain or spinal cord, the location, the size, the shape, the number, that are most indicative of whether the problem is multiple sclerosis or not. There are people in whom we say they have a radiologically isolated syndrome, and that simply means that their MRI looks like MS, although maybe they've never had any neurologic symptoms to tell us that they actually have the condition. There are people we call a clinically isolated syndrome. Maybe they've had one neurologic symptom or relapse or attack and MRI changes that look like MS, but they've never had a recurrence to let us know that this is a recurrent problem. And those often are folks that we follow along either on therapy or off therapy while we continue to monitor their clinical course and what happens to their MRI scans over time. So the diagnosis can be challenging. There are many people who have white spots for other reason, and they get diagnosed with multiple sclerosis, and fortunately they don't have multiple sclerosis on many occasions. There are other people who have lots of symptoms, but we don't see any signs of multiple sclerosis, and so there are many diagnostic challenges. There are also many circumstances in which the diagnosis is perfectly clear. It can be a very challenging diagnosis to make, and so if you have a challenging circumstance, I'd recommend that you see somebody who sees a lot of MS and struggles with these challenges every day. So sometimes it's very challenging and sometimes not so much. And often the diagnosis becomes clear over time when it's not clear in the beginning. think I'll leave it there for now in terms of discussing the diagnosis, and then we'll move on to additional topics. Thank you for your attention.